I'm here with David Bibbey from Alternative Primary Care, and we're here to discuss an alternative to medical care, especially when Western medicine, has been unable to help.
Yep.
Good afternoon, David.
Good afternoon, CJ. Thank you.
Can you briefly explain traditional Chinese medicine?
Sure. Traditional Chinese medicine is several thousand years old, and it's a system of medicine that is designed to address patients' health in a holistic fashion, where we're considering things like their diet, their sleep habits, their work demands, their emotional demands, and all of those things are considered from a physician standpoint to address whatever a patient's complaint is. So traditionally, we see probably 80% of our patients for pain-related concerns, and that's typical to how traditional Chinese medicine is used in the United States, as opposed to how it's used around the world. In mainland China and other parts of Asia, it's used more holistically like a primary care provider. You might go in for a headache, for a cold, for a GI complaint. Here in the United States, maybe only 20% of patients that we see come for those types of constitutional concerns. Most of our care is in the pain paradigm. So neck, back, shoulder, hip, leg, things like this.
Okay, and so you would use a lot of times acupuncture for some of those painful conditions?
Right. So since we're treating pain, we tend to use acupuncture more than other treatment options, whether it's Chinese herbal pharmacology, food therapies, qigong, body work. Acupuncture tends to take a lead role in pain treatment because its mechanisms of action, the big question, how does it work? It interferes with certain types of brain chemistry and how we perceive, and then how the body repairs painful conditions, whether it's nerve pain, musculoskeletal pain, myofascial pain, or pain due to weakness.
And I would assume that's a lot less detrimental to the body compared to taking medications that mask the pain.
Well, there's a role and a place for both. You know, sometimes if your pain is really intense and it's interfering with your ability, for example, to get to the doctor's office for more care, taking an over-the-counter pain reliever or even a prescription medication for pain may be required. But in terms of a long-term strategy for treating the root cause of whatever's causing that pain, certainly acupuncture or body work, even Chinese pharmacology can be more effective than taking the same Advil or Aleve, not to use those two alone, but anything that's over the counter, using that on a daily basis or monthly basis or yearly basis certainly isn't going to treat the underlying cause for your pain.
And it looks like you do kind of look at the person overall instead of just one aspect of their pain. You kind of try to get to a root cause maybe of what is causing it. Look at the person as a whole person, not just an arm or a stomach or something that's hurting them. You kind of treat the whole human body.
That's our training, so we do it by default. You tend to really kind of have a more global appreciation for what might be causing someone's painful condition, and then that lends itself to giving them advice, maybe some lifestyle changes, things that they may include or exclude from a workout, or things that they need to change or consider changing.
And if somebody would like to come to see you, do you take any kind of medical insurance, or is it out of pocket?
No, here in our office, if somebody has an insurance product that includes benefits that reimburse for acupuncture or holistic care that we provide in the office, we are equipped to file claims for to the insurance company so the patients can make use of those benefits. What needs to be clarified at the beginning is, does the plan actually have benefits for acupuncture? And if the answer is yes, we take care of the claims. If not, then it would be a self-pay situation.
Okay, great. And is it my understanding that your first time visit might actually be complimentary?
Yeah, a lot of times, we're not always the first option for a lot of patients. They've been to massage therapists, they've been to physical therapists, they've been to their physician, they may have even seen a surgeon or had surgery. So often I like to have an opportunity to let patients just explain to me what it is that's going on, what they've tried, and then for us both to consider how acupuncture might fit into their treatment plan going forward. And it's not always the right, best, next thing to do for everybody. And maybe we just make a recommendation that they either revisit a physician that they talked to before, or maybe there's some new intervention that they should consider before they take time, energy, and resources to spend on acupuncture.
Well, thanks for your time today,
Thank you,
David.
thank
Appreciate
you.
it. And you're located where?
I'm here on Kings Bay Drive, 441. It's in the first block of Kings Bay, west of Highway 19 in the Kings Bay Plaza.
Thanks so much. This is CJ from Tropic Shores Realty, and I'm trying to help you live and love the Florida lifestyle. David Bibbey, thank you.